On this Tuesday night, Canada's GDP takes a record plunge. The evidence of how COVID-19 infected our economy and the promising signs of a recovery. The debate over delaying the second COVID-19 vaccine dose.
It amounts to a human experiment.
And the distrust in Canada's Black community over the vaccines.
He said, Patrick, if you don't take it, then I'm not taking it.
Just shelved why 6 Dr. Seuss books won't be published anymore. And rounding up support. The politician steering the campaign to make rodeo Alberta's official sport.
Global National with Donna Friesen.
Good evening and thanks for joining us. We all know 2020 was bad. Now we have a more accurate picture of how dismal it was for the economy in this country. It shrank more last year than it ever has since the Great Depression in the 1930s. Canada's real gross domestic product, that's our total economic output adjusted for inflation, shrank 5.4% in 2020. That's a far greater drop than Canada's banks predicted at the outset of the pandemic nearly a year ago. There are signs the economy began to bounce back towards the end of 2020. Real GDP grew by 2.3% in the last quarter, and the forecast for 2021 is looking brighter. Economists expect continued growth in the months ahead as vaccines roll out, restrictions ease, and Canada gets back to business. David Akin has our top story tonight.
We had high hopes in January, February, and we're looking at good growth from the year before, and then March hit and it was just like an immediate dip.
Across the country in 2020, business owners struggled through a cycle of lockdowns and reopenings. Many survived, but many went under. Thousands more were forced to lay off workers. In fact, nearly 1.5 million Canadians have still not returned to pre-pandemic work.
We're about 20% down in our number of employees overall.
Ever since Statistics Canada started measuring the economy more than 60 years ago, the agency has never had a year as bad as the last one. The Canadian economy contracted, shrank by 5.4% in 2020 versus 2019.
Oh, it does mean a lot. I think part of it is just the severity of it and getting out of the severe recession like this would be challenging.
But there are signs that things are looking up. For instance, those government transfers like the CERB and the wage subsidy, that helped individual Canadians replace lost income, especially among lower income Canadians. So much so that the gap between rich and poor in Canada got smaller. Canadians also saved nearly 6 times as much of their income than they did in pre-pandemic times. And that means plenty of pent-up demand that could help the economy recover faster and quicker in 2021 and beyond.
The key question is whether that bump that we are going to see would be sufficient to take us back to pre-COVID levels. And that is not clear.
Still, for many, the road back will be a long one.
Right now, we'll actually honestly be happy if we meet our 2019 levels. And that's going to be the first year for us that we haven't seen even a small amount of growth year over year.
David Akin, Global News, Ottawa.
The economic recovery is tied to the vaccine rollout, and there are signs that is picking up steam. More than 2 million vaccine doses have now been administered in Canada, including more than 54,000 given today. More than 1.4 million Canadians have now received at least one dose, and more than 545,000 Canadians are fully vaccinated with both doses. There is growing momentum behind a plan to extend the time between the first and second doses of the Pfizer-BioNTech and Moderna vaccines. BC is stretching that time to 4 months. The aim is to get at least one dose to more people, giving them at least partial protection. Now, other provinces are signaling they could do the same. Abigail Bimman looks at the reasons and what difference it could make.
BC is the only province to delay a second dose by 16 weeks, but the National Advisory Committee on Immunization is expected to release new recommendations on the safe interval between doses this week, and many other provinces are excited to follow suit.
With the variants of concern out there, this could make a significant difference for Ontario in reducing hospitalizations and deaths.
So we are considering that. We have looked at there's fantastic evidence.
This anticipated guidance is a significant development and a game changer for PEI.
On the island, it could mean everyone over 16 gets a first dose by the end of June.
What we're anticipating coming from NACI is quite a game changer for us. It's unfortunate that BC got out ahead of a national process.
While some are critical of more than just the timing of BC's move.
When you decide to try something new on an entire population, it amounts to a human experiment.
Canada's chief science advisor says while there is an argument to be made for a delay up to 56 days between doses based on data, she hasn't seen any data supporting what she calls a huge jump to 4 months.
I am concerned that we are confusing the public with just like many different guidance, studies here, studies there.
I think the real debate is how far can you extend the second dose? That's probably the more contentious point right now, not whether or not you can extend the second dose. I think most people would say you sure can.
Canada's top doctor said Tuesday, like with so many aspects of the pandemic, the science continues to evolve. Dr. Theresa Tam says the question of intervals between doses will continue to be monitored as more evidence comes in. Abigail Bimman, Global News, Ottawa.
There is some good news tonight about Canada's vaccine deliveries. The federal government says the first shipment of the newly approved Oxford-AstraZeneca vaccine is now en route from India. 500,000 doses are expected to arrive tomorrow. Canada is also set to receive about 445,000 doses this week from Pfizer-BioNTech. That makes this the biggest week yet for vaccine deliveries to Canada. There is some conflicting advice, though, over who should be given the AstraZeneca vaccine. Late yesterday, the Federal Advisory Group on Vaccines said people 65 and older should not get the shot because of a lack of data. Clinical trials of it didn't include people over 65. Other countries, including France, followed that same advice. Now, as more real-world data emerges, the advice is changing. Crystal Goomansingh explains.
With 70% of intensive care units in France occupied by COVID-19 patients, there's a push for more vaccinations.
Ici, vous avez le vaccin AstraZeneca.
On Monday, the country's health minister reversed a previous decision, opening up the age group eligible to receive the Oxford-AstraZeneca vaccine to those over 65.
Il y a une annonce importante qui a été faite par...
The government spokesperson says there's now some scientific publications showing that this vaccine is very efficient against severe cases of COVID-19, as well as in this age group. The vaccine has been a part of the UK's arsenal since January. The British Health Secretary highlighted preliminary data showing a single dose of Oxford-AstraZeneca prevented severe infection in those over 70, with a reduction in hospitalizations of more than 80%.
These results may also help to explain why the number of COVID admissions to intensive care units among people over 80 in the UK have dropped to single figures in the last couple of weeks.
Canada's National Advisory Council on Immunizations is taking the position France previously held. More data is needed as the initial clinical trials didn't include enough older individuals. Its recommendation is for the shot to be offered to essential workers under the age of 65. But Dr. Theresa Tam says it's an evolving process.
Don't read their recommendations as sort of static. They will update as needed.
Officials, however, stress all of the shots approved are safe and effective for adults. Crystal Goomansingh, Global News, London.
Quebec is making vaccinations in the Montreal area a top priority because cases of the highly contagious variant first identified in the UK are on the rise there. And the health minister suggested today restrictions could be extended or tightened in Montreal.
We are afraid that the Montreal region is the calm before the storm. And I think it's important that you take that into account for the announcement that we will make tomorrow.
84 cases of the UK variant have now been identified in the Montreal area. That same variant of concern has been identified in a recent outbreak in Prince Edward Island. 2 cases announced last week involve the B117 variant. Analysis is still being done on other recent cases. It's believed most of them can be linked PEI now has 22 active cases. It is these more transmissible variants that could drive a third wave of the pandemic. Tonight, Eric Sorensen looks at the delicate balance as we attempt to get back to normal.
There's been a remarkable downturn in COVID-19 cases since January. If only the trend were continuing. It's not. Worldwide, case numbers rose last week for the first time in 7 weeks.
This is disappointing, but not surprising.
The World Health Organization suggests COVID case numbers have stopped falling because people are letting their guard down, government's public health measures are being eased, and COVID variants are circulating. In Canada, COVID case numbers peaked in early January around 9,000 cases per day and then fell dramatically for 6 weeks to about 3,000 cases a day in mid-February. But they have remained stubbornly at around 3,000 a day since then. So what does that mean? Looking forward, the variants could cause a spike, a third wave. Or as spring comes along, there could be a wavelet, maybe ripples of new cases. And then as we get into summer, the vaccines could start to bring the numbers down, whatever they are, to a more manageable level once and for all. Modeling from Simon Fraser University suggests some provinces could see a sharp rise in variant cases if more proactive measures aren't taken, such as testing, tracing, and on travel.
We have to worry about places where variants of concern do take off. I think we all share wanting to relax restrictions. I think we need to be careful around variants because they are higher transmission.
Some experts believe case numbers will become less relevant than hospitalizations and deaths. In Canada, the number of hospitalizations has been declining steadily since January, and the same for deaths, from over 160 per day in January to an average of 42 deaths per day now. Still tragic, but getting better. And early vaccines for the most vulnerable should improve those numbers in the months ahead.
Now we know that vaccination can very effectively reduce death and hospitalization. So once you have this intervention, you can now scale back on community restrictions because we're not having as many people being admitted to hospital.
The COVID variants are not going away, but there is optimism that the spread of vaccines will overtake the spread of the virus and make the pandemic manageable by later this year. Eric Sorensen, Global News, Toronto.
The Black community in this country is among the hardest hit by COVID-19. In the first wave of the pandemic, mortality rates were 2 times higher in Canadian neighborhoods that have a higher proportion of racialized residents. Yet many members of those communities aren't jumping at the chance to get vaccinated. As Kayla McLean reports, the biggest barrier is broken trust.
Yes, I just finished doing the Moderna vaccine. It was painless and effortless.
Patrick Shaw got his COVID-19 jab to convince others in his community to do the same.
When I told people to start taking it, he said, Patrick, if you don't take it, then I'm not taking it.
Shaw is a COVID survivor. He's also an outreach worker in Northwest Toronto, home to the city's largest Black population. Many are essential workers living in close quarters.
They're shuttling back and forth in packed buses, but they're also, some of them having multiple jobs to survive. So therefore, the transmission of the virus is highly likely.
Overall in Toronto, 9% of the population is Black, and yet they account for nearly a quarter of COVID-19 cases. Even so, Toronto's Black community has the highest rates of vaccine hesitancy, 30%.
Folks understand that Black people have not been treated well. They've been utilized as guinea pigs for experimentation in the past. And if a government that has, in their opinion, mistreated them and not treated them well, should they listen to them? Should they trust them and take that vaccine?
Racist treatment by the healthcare system continues to be a concern today.
You should be able to go into an emergency room, a primary care clinic, a hospital, a general hospital, and receive the same quality of care, whatever your racial background.
One idea, prioritizing vaccines on the basis of postal codes. This would capture at-risk populations and save more lives.
I'm ready to go anytime you guys are ready to go. So.
Shaw says trusted community ambassadors also need to be included in every stage of the vaccine rollout so that the most vulnerable can be properly informed in a sympathetic way. Because what affects one affects all.
If you don't take care of it in this community, it's going to spread to other communities, right?
Kayla McLean, Global News, Toronto.
6 Dr. Seuss books will no longer be published because of racist and insensitive imagery. Dr. Seuss Enterprises says the books portray people in ways that they say are hurtful and wrong. Among the titles are the first book written under the pen name for Dr. Seuss back in 1937. It's called And to Think That I Saw It on Mulberry Street. In it, an Asian person is shown wearing a conical hat, holding chopsticks, and eating from a bowl. The decision to stop publication and licensing of this and 5 other books was made after months of discussion. The company says it's committed to representing and supporting all communities and families. Books by Dr. Seuss have been translated into multiple languages as well as into Braille and are sold in more than 100 countries. No more masks, no more restrictions. Coming up, the American states getting rid of pandemic protocols. The Biden administration, signaling a tougher stance against Russia, has announced new sanctions targeting senior Russian officials over the poisoning of opposition leader Alexei Navalny. The sanctions target 7 top business and political figures, including Russia's top spy, and 14 entities involved in the production of chemical and biological agents. The sanctions prevent the top figures allied with Russian President Vladimir Putin from accessing financial and property assets in the U.S. These are the first sanctions against Russia by the Biden administration. Russia is threatening to retaliate. Navalny is serving a 2.5-year sentence at one of Russia's harshest prison camps. Today, President Biden announced the U.S. expects it will have enough coronavirus vaccine doses for every adult American by the end of May. And 2 U.S. states are now taking major steps toward reopening. The governors of Texas and Mississippi have announced they are ending their statewide mask mandates. They are also allowing businesses to return to full capacity. Yesterday, Texas recorded more than 8,000 new COVID-19 cases. Family tragedy ahead. What happens when the front line hits home for healthcare workers? Frontline healthcare workers dealing with COVID patients not only worry about getting sick themselves, but about bringing the virus home. They take extra precautions to minimize the risk, of course, but that is not foolproof. Karen Lieberman has one woman's heartbreaking story.
Hi, I'm Anissa, the safety officer.
Safety specialists work behind the scenes. They support frontline healthcare staff, ensuring they have adequate supplies and personal protective equipment.
You have all the tools that you guys need.
And that they're following safety protocols.
We understand this is a stressful time. At the end of the day, we want to be safe and go home to our families safely.
For Anissa Khan, until recently, that included distance visits with her parents.
Here I am pushing staff at work to be safe, not to get it and whatever. And lo and behold, my family end up getting it.
First, it was Khan who tested positive for COVID-19. Then her mother, then her father fell ill too.
When I went to go visit him, he was like this.
Rodney Berja was rushed to hospital in early December. He's been there ever since.
He had a condition that we call ARDS, or acute respiratory distress syndrome. He had really profound needs for oxygen.
Both parents critically ill. One wouldn't make it.
It was very difficult. And then the next morning we get the phone call from the ICU physician saying, you know what, we have to intubate your dad.
Berja was unaware his wife Marilyn had passed. More than 2 weeks later, on his 70th birthday, he needed a tracheotomy.
Losing mom and then hanging on desperately that dad won't be, another one gone.
Fortunately, he began improving.
And dad's up in the chair looking like $1 million.
Every day, Khan FaceTimes her father to check in or visits him in person.
Because he was starting to ask about mom, how's she doing, where is she?
The family had to share the heartbreaking news his wife did not survive. But he is on the road to recovery. And with the tube removed from his neck, he has his voice back.
Rodney, how are you feeling?
Oh, not too bad. I take it one day at a time.
For Khan, seeing her own family struggle has been hard.
I never thought I'd be here in a million years, and here I am.
And a reminder to others.
Instead of snap of a finger, things can change very, very quickly for you.
Karen Lieberman, Global News, Toronto.
Trying to wrangle up support next, the sports debate in Alberta. It is a cliche to think Alberta is all about cowboys, ranches, and oil fields, but there is a push right now to elevate the status of rodeos, to make them Alberta's official sport. Heather Urix-West explains why some believe the sport deserves a leg up.
Nanton, Alberta's Logan Bird is a Canadian champion in tie-down roping. But right now, he can only compete in the United States.
For me, at the professional level, there was nothing. Since COVID hit, there hasn't been one event.
Every member of the Bird family is heavily involved in rodeo. It's how they make their living. So it's no surprise they fully support efforts to make rodeo Alberta's official sport.
It absolutely should be an official sport. There's lots of people, and I mean a lot, that make their living with rodeo.
The private member's bill was put forward by a Calgary United Conservative Party MLA who was introduced to rodeo culture later in life.
The significance of this event in rural Alberta, it was just amazing. It brought people together.
Mohammed Yassin grew up in Pakistan, but fell in love with rodeo after coming to Alberta as a young man. Designating rodeo as an official sport would be a mainly symbolic gesture, but it isn't being welcomed by everyone.
Rodeo is frankly a very risky sport that causes intense amounts of suffering and regularly causes death. Alberta shouldn't be considering celebrating rodeo as the provincial sport. It should be considering banning this activity.
The province has not yet decided when rodeo events in Alberta might be able to resume. The Birds hope it happens soon. The ability to come home and get back to work more important than any gesture of goodwill. Heather Urix-West, Global News, Calgary.
And that is Global National for this Tuesday. I'm Donna Friesen. We leave you tonight with a bit of news from music legend Dolly Parton. She got a dose of her own medicine today. Dolly donated $1 million to help develop the Moderna vaccine, and she encouraged others today by changing the lyrics of one of her songs.
Vaccine, 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 vaccine. I'm begging of you, please don't hesitate.
To anyone feeling a little fearful, Dolly says, don't be such a chicken squat. Her words, not mine. Thanks for watching. Hope to see you here again tomorrow. Take care of yourselves. Bye-bye.